Hello, I'm Carol Reed. I'm with the Needham Coalition for Suicide Prevention. I welcome you here today for another segment in our continuing programming to reach out to Needham residents and educate you on our prevention efforts to promote awareness and resiliency among our population and to prevent suicide. We're happy today to be joined by Marissa Howard-Karp. Marissa, welcome.
Thank you.
We are grateful for you being here to share your expertise with us. And would you mind letting the audience know what your specialty is and your expertise in our focus today on GLBT youth and prevention and resiliency?
Yeah. Thank you for the invitation.
You're welcome.
So I'm the program director for a program called the Gay, Lesbian, Bisexual, Transgender Youth Support Project, which is out of an agency called Health Imperatives down in Brockton, though I'm a statewide program. Our mission is to create welcoming and supportive environments for gay, lesbian, bisexual, transgender, and then we also add questioning youth and for their families. So we do this by working with schools and all different kinds of community-based agencies around the state to support providers and educators in learning how to be responsive to the needs of GLBT youth and to support their families in order to prevent a crisis, in order to create an environment where people really are okay feeling like they can be open about who they are, that they can get help for the things that they need help on, that they can seek out safe, supportive adults for anything that they might need.
Great. I know that your work is highly sought after, and I've had the pleasure of being in a training that you did, and your work is very enlightening as well as provides people with strategies and concrete learning tools to be able to support GLBT youth. Can you share with our audience today what GLBT means for those who aren't fully informed?
Yeah. So we're talking about two different things, actually, and we lump them all together, which creates some confusion for people. But when we're talking about a person who is gay or lesbian, essentially what we're talking about is a person who is primarily attracted to people of the same gender. So we're talking about sexual attractions, but also emotional, romantic, chemical, kinetic, spiritual, any of the ways in which people can be attracted to each other. They have those attractions primarily to people of the same gender. When we're talking about somebody who is bisexual, we're talking about somebody who acknowledges their capacity to be attracted to another person without gender being the first thing on the list. Okay. So they may or may not act on it, or they may be involved with people of different genders at different points during their life, but it's really about acknowledging that that's something that they're open to. And then when we talk about a person who's transgender, what we're talking about is a person who, as he or she grows up, comes to realize that who they really are inside in terms of their gender is different than the gender that it was always assumed that they were, based on really what was between their legs at the time that they were born. They come to understand themselves in a different way than people have told them about who they are. And so often you'll see people who will make what we call a transition, which can be about changing how you look and how you present yourself in lots of different ways so that other people understand you the same way that you understand yourself. So that's really what we're talking about when we say transgender. And here we are talking about both sexual orientation and gender identity, but we lump everything together and we say GLBT.
Can you share with us about what age a young person would start to think that they were gay, and educate us all a little bit on that topic?
Well, I mean, it certainly looks different for every person out there. What I always ask people when they say, how early does a person know that they're gay or lesbian or bisexual or transgender, is, when did you know you were straight? And a lot of people will say, I always just knew. And sometimes for a person who is gay or lesbian, bisexual, transgender, it can take longer to figure out, to put words to what might be going on inside. And then it can be a whole other process to actually start sharing that information with other people around you. And so it's very difficult to pin down exactly when people know. And again, like I said, it's different for everybody. But typically what we're seeing is the average age of coming out as lesbian or bisexual for girls is somewhere around 15 or 16, and a little bit later for boys, probably just because of how adolescent development works. And the typical age when people are coming out as transgender is still considerably older at this point. But when we look at those numbers over time, we've seen all of those numbers get younger and younger. And that seems to be pretty much in direct correlation to how much safety and support is out there, which is also partly why I think people are coming out as transgender at a later age than people who are coming out as gay, lesbian, or bisexual, because we still don't have nearly as many, legal protections, education, role models, all those different things that people really rely on to put together all the different pieces of who they are, be comfortable with it enough to share it with the people around them.
Okay. You were referring to the age getting younger and younger, and I've heard that families' acceptance of their child's sexual orientation or gender identity plays a significant role in the risk of suicide. Can you share any information with us to shed some light on that?
Absolutely. I think that there are a couple of different pieces, and the first piece is that youth typically depend on their family members as a primary source of support. And that family can look like lots of different things, and youth can get a lot of support from adults around them who are not their family. But that is a natural place to start, which is also sometimes when we see young people come out, their parents may be the last ones to know, because the parents are the most important to them emotionally and in terms of getting a lot of their physical needs met, like housing and transportation to school and money in their pocket and food on the table. There was some research that came out in the last year or two from a program called the Family Acceptance Project out of San Francisco State University that looked specifically at the level of family acceptance or rejection when a child came out. And their research included families with children from, I think, fairly early adolescence to young adulthood. And they were able to pin down a direct correlation between how rejecting the families were and the likelihood that their child would attempt or complete suicide, that they would use drugs or alcohol, that they would have unsafe sexual practices. There were a number of other risk factors that they measured, and there was a correlation between all of them. And of course, the way that research is worded, the way they did this, I think they found specifically the more rejecting a family is, the higher the risk factor is. I think that was how their findings were framed. But we can assume that the opposite is true as well, that the more accepting a family is, the safer that young person actually is. And one of the great things about this research, it was all based on qualitative interviews. And after they came up with their findings, they went back to the families that they had interviewed and they shared their findings with them. And a lot of these families were really shocked because they saw it, especially the rejecting families, really saw this as a difference in values. And it had not really occurred to them that they were actually having a negative impact on their child's health by doing this too. One of the other great things about it, which made this all feel so attainable, is that the research found that these families didn't have to go from, we kicked our child out of the house to, we're planning our child's same-sex wedding at the Four Seasons in order to improve their child's health, that it could really be about reducing the frequency of name-calling. Or it could be about saying, I don't agree with you, or this doesn't fall in line with our faith, but we love you. We don't have to see eye to eye, that families didn't necessarily have to change their fundamental beliefs and values and approaches, as long as they were able to keep their eye on the prize. And in this case, the prize was maintaining a relationship with their child and supporting that child in remaining healthy.
Right. And I know that you've shared with me the Greater Boston group that supports families. So this might be a great time to to share that organization.
Sure.
Could you do that?
Yeah, these are our colleagues. They're under the name of Greater Boston Parents, Friends, and Families of LGBT People, and they go by the acronym PFLAG. It's actually a national organization, but in this area, Greater Boston PFLAG provides support to the network of support groups all over the state. And many of these groups get together once a week or twice a month, and they're open to any family member or close friend who has a gay, lesbian, bisexual, transgender, or questioning family member. And the idea is really for people to be able to go and connect with other families and share their struggles, share their strengths, and really just provide the support to each other that they need in order to be able to maintain their families as intact families.
And those very important relationships, which are the huge protective factor that we spoke about.
It's a huge protective factor.
Great. I'd like to spend a little time talking about bullying. You know, bullying is so very much a part of our awareness today with the legislation that was passed in Massachusetts and in other states around the country. Can you tell us about the relationship between bullying and GLBT youth and the risks and protective factors associated?
Sure. I really think that this is a sea change in the same way that we saw a sea change in attitudes around bullying in the incident that happened at Columbine 10 years or so ago. People started to take it seriously in a very different way. I think for a long time we talked about bullying as just kids will be kids. We all experienced it either as the bullies, or we witnessed it, or we were bullied ourselves. And so I think that with the shift in attitudes and with a few really sad, high-profile suicides of some gay, lesbian, bisexual, transgender teens recently, people are starting to pay a lot more attention to that issue. But the reality is, I don't think this is new. In fact, I think this is something that we've been struggling with for many, many years, that this has been a reality. And so I do a lot of training, particularly in schools, but also in community-based agencies, with folks on how do you prevent and how do you address anti-gay bullying, what we call quote-unquote anti-gay bullying. And sometimes people will say to me, bullying is such an issue across the board that we just passed one of the toughest laws in the country. You know, all of our schools now are mandated to have a strategic plan around this. Why are we specifically talking about this population and bullying? So number one is we know that the numbers continue to be disproportionate. That in one study, they interviewed, I think, youth who identified themselves as gay, lesbian, bisexual, or transgender, and asked how frequently they were hearing anti-gay slurs during the school day. And it worked out to be about every 15 minutes all day long. So this is not to say necessarily GLBT youth are the worst off and nobody else is dealing with it, but this is one population that we're seeing dealing with just a tremendous amount of bullying. The second piece is that when we teach people the skills and give them the tools to prevent and address anti-gay bullying, we're really addressing the issue on a whole lot of different levels. First of all, the skills are totally transferable for preventing and addressing all kinds of bullying. And we're helping them address a really frequent kind of bullying, because often when I start my trainings, the first thing I'll say to people is, how many of you in the room have heard somebody say, "That's so gay"? And every soul in that room stands up. They're all hearing it, and I don't care if they're teaching at the college level or if they're teaching at the elementary level, the responses are the same. Mm-hmm. So the skills are transferable, and when we're talking about what we refer to as anti-gay bullying, what we're talking about is bullying that targets youth who are openly gay, lesbian, bisexual, or transgender, youth who are perceived to be gay, lesbian, or bisexual, or transgender, which usually actually has very little to do with sexual orientation and much more to do with whether they cross the lines of what we consider appropriate for their gender in terms of how they dress and present themselves. And quote-unquote anti-gay bullying tends to target any other young person who's associated with GLBT folks. So folks who are friends with GLBT folks, who are part of a gay-straight alliance in the high school, as an ally, who have GLBT parents or other family members, or even who is just outspoken about GLBT rights. So we're talking about an enormous population of youth who are impacted by quote-unquote anti-gay bullying. And when we can give the adults in any given setting like that the tools to deal with it effectively, not just push it under the rug or push it out into somewhere else where there's no adult supervision, but to really address it, we see it kind of lift the bottom up and improve the situation around bullying across the board based on any reason.
Yes, and starts to change the cultures.
And when we're talking about effective bullying prevention, it has to be about a cultural change. It can't be about just one teacher. And I wouldn't say that to discourage any one teacher from being really firm about that in their classroom, because it has to start there, but it can't end there.
Yes. Marissa, we have gay-straight alliances in high schools. We have same-sex marriage, other protections in the Commonwealth. It seems like things have improved for GLBT youth and adults in our state. Why are we still having these same conversations of struggles for GLBT youth and adults in our state? Can you shed some light on that for us?
Yeah. I think that's a question that a lot of people are asking because things do look really different for GLBT folks in Massachusetts than they did, even a handful of years ago, and are still considerably better here than in many parts of the country. And all of that does have a very positive impact. But we're talking about a number of different issues here that all can correlate to higher rates of suicide attempts. And legal protection is certainly one of them. So while we do have same-sex marriage, which was a tremendous victory, we're still working to actually get gender identity included in the state's non-discrimination policy. So right now, it's perfectly legal to refuse to hire somebody, to fire somebody, to refuse to provide them housing based on them being transgender or your perception that they may be transgender. It's perfectly legal to do that. Insurance coverage, all sorts of issues like that are often based on employment and marriage. So we're looking at a lot of different medical issues, particularly for adults, but then also for youth. I think that in terms of youth-specific kinds of things, what we're looking at is folks who really don't have enough GLBT role models in terms of peers, in terms of teachers and other adults in the community. We're looking at history classes that don't necessarily include much, if anything, in the way of GLBT history. Or if they feature, famous GLBT folks in history, their sexual orientation is really not discussed. We're not necessarily talking about GLBT health issues in health classes, in sexuality education classes. There are a lot of different pieces like that. And I think that while we're starting to have some really groundbreaking examples, there was a young woman named Constance McMillan in Mississippi last year who actually successfully sued her school district because they didn't want to allow her to come to the prom with another young woman as her date. So we do have stories like that are coming out more and more often, but I still think those are the exception more than the norm, which doesn't make them any less powerful, but it does mean that, if you think about, for example, a person of a religion, of one religion that they share with their family, and they're growing up in a community where they and their families are the only ones who hold that faith, then they're not having all of those role models around them, but they may still get it from their own family members. And maybe they also have a congregation or a community of some sort where there are some other role models in terms of both peers and adults. When we talk about GLBT youth, we're often talking about youth who need to find that piece of their culture on their own because they're frequently not born into it, and it's not necessarily a real strong presence in the places where they spend the most time, like school, after-school programs, maybe camp, employment when they're at the high school level. They're not really immersed in it in the same way that youth who are not GLBT tend to get immersed in their culture every day, all day.
Okay. Marissa, what can we do in Needham to support our GLBT youth and adults, and as a community, how can we improve? Can you share your thoughts with us on that?
Well, I was really glad to hear you talk about having a gay-straight alliance at the high school. We do know the research shows that the existence of a gay-straight alliance is a huge protective factor for GLBT youth, even when they're not actually part of the gay-straight alliance. Just its existence is really significant. So one thing that folks can do if they're involved with the school system, with the high school, certainly is call them up and say, how can we help? Because I can tell you there's not a GSA in the state that doesn't need money or volunteer time or transportation or anything like that. So that's one place to start. Certainly for folks who have GLBT family members or friends who have GLBT children, they're struggling, making sure that they know about groups like Parents, Friends, and Families of LGBT Youth, that they have free support groups all over the state. There's a group that just started in Wellesley, which is, they're calling themselves WAGLY, and they are a support and social group for GLBT youth in the west suburban area. It's a brand new group, and they had a real strong attendance for their first few meetings. So getting in touch with them, finding out, do they have flyers that they want to share with people? Are there groups where you can help spread their information? Do they need anything? Because I'm sure they probably need money. They probably need volunteer time as well. And then just in terms of sort of day-to-day living, being aware, I think, of what are the things that are coming out of our mouths casually. Where are we reinforcing gender roles unnecessarily? Where are we making assumptions that a woman with a wedding ring on has a husband instead of a wife? These are things that seem very small, but sometimes being able to have conversations with people about saying, oh, I saw this movie and it had, these GLBT characters in them, or so-and-so and his partner, even using that kind of language in casual day-to-day conversation shows the people that you're talking to that the door is open, that this is something that you're open to, and you're modeling that for other people, even if it's so subtle you think that nobody's even noticing it. And then certainly if you have GLBT folks in your life, if they're adults, go to them and say, hey, listen, I really value our relationship. I have been hearing some of the information about suicide risk. Have you ever felt that way? Are there things that I can do? Are there ways that I can support you? Are there other ways that I can get involved? And if you know of GLBT youth who are out and maybe struggling either with being comfortable about who they are, or with maybe they're perfectly comfortable in who they are, but they're having a difficult time with other people around them, knowing that information, really going to them and just saying, I support you. Can I do anything for you? And I think we've all been in that place where we're having a really difficult time with somebody or with something, and somebody close to us says, how can I help? And all you want to say is, that helps.
Yes.
So really just making a point of reaching out, of recognizing that a person who is gay or lesbian or bisexual or transgender, or questioning, which is a way that we often describe adolescents who are moving through that process of trying to figure out for themselves really who they are in terms of their sexual orientation and their gender identity, recognizing that they may be involved in those struggles or that they may have gone through some of those struggles, and just making a point to go a little bit out of your way to say to them, I get it. I want to learn more. I want to do something if there's something I can do.
Right.
It makes a really big difference.
Those are wonderful strategies. Are there articles or websites that you feel may be potentially informationally appropriate, or anything else you'd like to share with our community today to assist us in keeping youth and adults safe?
There are just a couple of resources that I would mention. Two of them actually I mentioned already. So the Parents, Friends, and Families of LGBT Youth is a terrific organization. And the Boston Alliance of GLBT Youth is the sponsor organization for the Wellesley group that I had mentioned. And they also oversee and support a network of similar youth groups all over the state. So they're an excellent resource. And in terms of online resources, Advocates for Youth has terrific health information for LGBT youth, but also just adolescent health in general. And there's an organization called the National Youth Advocacy Coalition, which is also great resources specifically for GLBTQ youth.
Okay.
So those are the others that I would mention. One last resource that I did want to mention, of course, is my program, the GLBT Youth Support Project. So there are a few things that we do. Essentially, we offer training, and we do it live for schools and community-based health and human service organizations all over the state. We also have an online training, actually, which is open to anybody. That's going up June 1st on our website. And in addition, we have a monthly electronic newsletter. We provide lots of resources, posters, stickers, cue cards that give people quick tips about how to handle specific situations, fact sheets, all those kinds of things that are available for free on our website. And of course, we're on Twitter and Facebook too. So I hope that anybody who's interested will check out the resources that we have, because it's really fun to be able to learn about what people are doing and support them in integrating this kind of work into the work they're already doing.
It's great. Is there anything else you'd like to share with us?
I think this work can be difficult for people sometimes if they feel like they're not entirely comfortable with the issue, or they feel like, you know, this is in conflict with their faith values or their value system in general. And one of the things that I would say is that, and this goes back to what we were talking about with families before, this is really about remembering what the bottom line is. And the bottom line is, we want to keep kids healthy, we want to prevent suicide, and we want to prevent other risk factors. And what we know, based on all the data that we've seen about efforts to support GLBT youth, is that the more efforts are made, the healthier we're seeing this population. There's a direct correlation between how much support the population gets and how healthy they are, just like with any other population. So even if this is something that you as an individual are not entirely comfortable with, there are still ways that you can really support somebody in growing up to be a healthy, successful adult. And so much of it just starts with, I'm here for you.
Yeah, that's fabulous. And it's easy for us to take those steps every day and start to incorporate that language into our everyday conversations. I so appreciate you being here, for sharing time with us and to educate us in Needham. And maybe you can come back another time. And again, we are very grateful. Thank you all for watching today. If you have any questions or need for further information, please call the Needham Public Health Department or log on to the Needham Coalition for Suicide Prevention's website, www.needhamax.org. Thank you very much.